Knee pain is common, especially during walking, climbing stairs, or even turning in bed. What many people may not know is that the knee is not just a weight-bearing joint, it's a weight transfer joint. When movement or alignment changes inside the knee, stress and movement can also change above or below the knee. I'm Yama Zafer, a chiropractor. In this educational video, I will explain how knee issues develop and how exercise fits. I'm here with my buddy George. We're going to go over some important facts about the knee. The knee joint is a weight-bearing joint, but more important than that is that it's a weight transfer joint. Yes, you heard me right. It is a weight transfer joint. What I mean by that, any activities that takes place at the lower back, at the pelvis, at the hip, at the ankle. Let me use baby George so I can point to all these areas and you can follow. Activities and movements taking place in the lower back, at the pelvis, in the hip, in the ankle, as far down as your feet, or impacted or directly correlated with issues or structure in function in health of your knees. The better the knee does, the better these parts do. When you have problems down here, it can impact the knees and vice versa. Every movement matters. Why? Because it's a weight transfer joint. And as such, it's important that you pay attention to the weight-bearing structures of the knee, specifically the cartilage. The cartilage is a covering, much like the covering at the end of the chicken bones. This is part of a knee joint. Thigh bone, shin bone, in between the blue part, the meniscus. Now, the cartilage, on average, is 2 to 3 millimeters, depending on your size and state of health. Its purpose is to absorb shock, to absorb movements, and to cushion the knee itself against stressful events that transpire to it. Now, another shock absorbent structure is the meniscus. Meniscus is a major shock absorber. In fact, 50 to 70% of the weight that's transferred to your knees when you're standing is absorbed by the meniscus. And it can be as high as 90% of that shock when you climb up and down stairs. Other structures that help movement, stability, and function are the ligaments. Again, these are too broad and deserving of its own video in which we'll provide for you. Now, in just a moment, I will go over the reasons why this weight transfer, this weight-bearing joint is important, and what types of issue occur that causes some of the discomfort that you have. And in my opinion, one of the most common issues that present are knee problems resulting from minor misalignments. And we will discuss those and how it impacts not only the meniscus, but also the cartilage and the degenerative processes. We talked about knee being a transfer joint. All movements go through the knee. Everything must pass through here. If it's healthy, all is good. No problems are felt, and you will be feeling good. However, when issues develop, be it at the meniscus, at the cartilage, or the ligaments along the side, these will collectively impact how you feel. The knee, like I said, is a weight-bearing joint that transfers the weight of the body on down to the knee joint and to the ankles. In a perfect case scenario, the weight comes down. As it enters the knee, it's distributed on the two menisci, one on the inner side, the other on the outer side, both being C-shaped, from there onto the shin bone and down to the ankle and feet. That is if the structures are healthy. A healthy cartilage should look like this, nice and smooth. No degenerative changes, no cracks, no wear and tear. A damaged cartilage. Healthy part here, you can readily see that. A cracked cartilage. There. That's a degenerated cartilage. That's a problematic cartilage. That's worn out. That by itself will cause discomfort. And it happens when distribution of weight is not even. It happens when the knee alignment is not proper. When issues develop, the knee can be off center, tilt to one side, the joints that is, due to ligamentous weaknesses or tightness, or degenerative changes within your meniscus. When this takes place, the uneven weight bearing or that uneven transfer of your weight as it goes down through the knee joint will further cause the degenerative processes to advance. End result being more discomfort, more stiffness, frequent flare-ups, and it may even get to a point that where just turning in bed causes discomfort. But all of that can be assessed and identified. Oftentimes, I tell patients to get an X-ray, or better yet, an MRI. An X-ray can assess the alignment issues. And if you're worried about alignment, the best X-rays are the weight bearing, where you stand and an X-ray is then taken. MRI, on the other hand, is the gold standard for identifying the health and well-being of the cartilage. Do you have cracks, like the ones I showed earlier? Or the meniscus itself? Is it worn out? Is it degenerative? Is it torn? Or there are issues with it? That is the job of an MRI imaging. Whatever may be the case, the number one goal, in my opinion, is to identify what caused it, what structures are damaged, how advanced this is. Is this still manageable with conservative methods, or has it passed that point? These answers need to be identified, and you need to go to your physician, to your healthcare provider, be it a chiropractor or physiotherapist, to have this properly assessed. And of course, after the assessment, X-ray or an MRI is the next best step, following which I would recommend, in instances when appropriate, conservative care. To me, conservative care means care that is specific for you. You have to keep in mind, just cracking the knee and twisting it and doing aggressive exercises may not be beneficial. But in order for care, be it conservative or invasive, to be beneficial, it must be specific for you. It must address the root issues identified through assessments, imaging, be it X-ray or an MRI, followed with specific exercises. But the care you receive for your knee should never be painful. Remember my motto, no pain, more gain. Now, enough on that part. What I like to do next is to show you what are some of the exercises I would recommend. Over the years, thousands have asked me, knee exercises. I need knee exercises. You may be one of them. In this video, I will cover some of the common exercises that I have given out over the years. But before you do any of them, please make sure you consult your doctor, your healthcare provider, to make sure that they're appropriate. First knee exercise, warm up, toes up, heel up, toes up, heel up. Repeat, 10 seconds, 20 seconds, activating the muscles, front of the legs, back of the legs. Once this is done, in and out, in and out, in and out. This should be done, but avoid doing this. Do not move your hips. It's just the ankles and the feet moving. That will also activate the muscles on the sides. Okay, let's go to the next one. The second exercise you do is pointing with your toes, stretching the front of the leg muscles, and then bringing it up as far back as you can and holding it for a few seconds. Repeat several times, but make sure you're comfortable while you're doing it, and it should not be painful. When you do knee exercises, it should be done on both the bad knee and also on the good knee. You have to exercise both sides. Let's go with tubing exercises next. You can use a tubing like this in a seated position, but use a very gentle one. This one is a bit firm, and this is super firm. I'll go with this one to show you. What you need to do after you put it on basically going through here and bringing it up, putting it here. Hold 2-3 seconds. Relax. Wait 2-3 seconds. Activate again. hold, and then slowly bring it in. Again, hold. This is for the outer and inner thigh muscles. This will help activate them and improve not just your knees, but also your hips and your lower back. Now it's time for the next exercise. And this is squats. Squats are very particular, and it must be done properly, otherwise you'll damage your knee more. A lot of times I ask patients, have you done squats? They say, yes, I have, but they're doing it wrong. Here's how to do them wrong. Knee in front of your toes. That's the wrong way. Now, if you have knee pain, knee issues, you want to do squats against the wall. You do not want to do full squats without support of a wall because it will be too much stress. How you do? Stand about that far from the wall, lean like I am, and slowly lower your body. And see if you can balance your body onto your legs. Most important, the knee should never cross your toes. So when you look down, you should be able to see your toes further away than the kneecap. You hold that. If it's not painful, hold it for 15 seconds. If you can go longer, perfect. If it's painful at 15 seconds, use shorter time. When you master this, and when your knees get strong, your leg muscles get strong, you can try lower and lower until you hit the 90-degree mark. Here, that is when you really feel the burning on the sides here, on the top quadriceps and hamstrings and in your bum. Perfect exercise, not just for the knees, for the hips and for the back. And I hope that helps. This is concentrating on the thigh muscles, outer, inner, quadriceps, and hamstrings. You'll need a yoga mat, something comfortable to lie on. First, use an ankle weight. It's good. If you're starting, do it without weights. That's what I would recommend. What you do is you lift up. You push the chair back, lift up, hold 1, 2 seconds, 3 seconds, and down, whatever is comfortable. Do this 5 times. Once you're done with this, you will need this chair. That's why it was there. Let me bring it here. Put the top foot on top. Keep the bottom foot in the bottom and lift this one up. Hold for 2 to 3 seconds. 5 seconds if you can, and then down. This exercises this muscle. The one we did earlier, this one, exercises the outer muscles. You need to do both. And then you need to turn over onto the other side and do the exact same thing for the opposite side. This is great, not just for the knees, but also for the hips and your lower back and your buttocks. An awesome exercise. Then you can lay on your back. Push the chair back, away from you, and then you lift up. To make it even harder, more difficult, point with your toes. Flex upwards, same as you did during the warm-ups. And then lower. Do the same here. Point, contract, point, pull, lower. And these are the additional exercises you will need to do. But you have to be careful. If it is uncomfortable or painful, you shouldn't do them. Reminding you of my motto, no pain, more gain. Always remember to start slow. But even before you start a slow program, make sure it's right for you. Now, another set of exercises that might be good for you or someone who has knee problems that could benefit from is weight training. But weight training using machines like this one, a leg press machine, or the Adductor machine in here, or some of the other machines on the other side. In just a moment, I will cover them. Many that have knee issues often turn to strengthening programs, which is perfect. But 2 criteria must be met. The exercise program you enroll yourself in or you opt for must be first age appropriate and secondly condition specific. For example, you can do ellipticals, bicycle, stationary, or use machines like those behind me. Now, for the elliptical, awesome machine, great for everything, upper body, lower body, and legs. However, you have to be very careful that as you use the elliptical, you should not have any discomfort. If you experience pain while you're doing it. It means that it may not be specific or that your knee may not be ready for it. Now, for bicycling, let's go there. Stationary bike exercise programs are great. You have to start slow. And you have to make sure that you don't experience discomfort while you're doing it. In other words, you don't want to get into a machine like this and start going through it as if you're participating in a race. Start slowly, gradually build up. As your knees improve, you can add more resistance and go for a longer time. Now, other exercises. Now, some weight training. A good machine is a circuit machine, much like these, for your quadriceps and for your hamstrings. I will show the quadricep exercise. Again, make sure that it's appropriately positioned for you, as it is for me, and then engage. Slow movements. Hold it in the extended position for a few seconds and lower slow to activate the muscles and get the benefit you need. Again, nice and slow, low weights. Do as frequent reps as possible, but without discomfort, without overdoing it. And then when you're done with this, go for a short walk, 10, 20 seconds, come back, repurpose this so you can use it for your hamstrings. In machines like this, the hamstring is used this way. This part usually flattens down, and you lay on your tummy, and then you do hamstring curls. This way, you get the muscles here in the front of the thigh, the quadriceps, and the hamstrings strengthen. If you strengthen your quadriceps, you must also do a bit of work for your hamstrings. Yin and yang, balance, that is important. Now, we work on exercising the inner thigh muscles and the outer thigh muscles, important for knee. Now it's time for the inner thigh muscle, an adductor, abductor machine, much like this. Squeeze, open up. This is to strengthen the inner thigh muscles. Now the same machine, I'm sure if you are going to a gym or if you have a gym nearby you or to a therapy center much like ours, they will have machines like this where you can adjust and have it appropriately sized for you. And then you can do the opening. This is to open up the hip joints, the side muscles. This is a great exercise. Again, much like we discussed when we are talking about the quadriceps and the hamstrings. When you do one side, you also do the opposite side. In other words, if you work on the outside muscles of the thigh, you must also work on the inner side. Another good exercise that you may want to think about doing is leg press. Leg presses are good. They're good for the back. They're good for the knee, for the thighs, for the buttocks. I hope the exercise part helps. That brings our knee session to an end. If you have any questions, drop it in the comment. Until our next session, stay blessed wherever you are.